So the body produces saliva that we use to lubricate our mouth, and these are produced by four major glands. So we have the parotid gland, which sits just in front of the ear, what's called the submandibular gland that sits under your jawbone, and these are our major salivary glands, and these can be affected by growths, by blockage, by infection, and that may sometimes require us to remove them in order to treat the problem. We also have lots of little minor salivary glands, which is a kind of separate problem and condition. So depending on the condition, we either have what we call a traditional open procedure. So this requires an incision, usually on our neck or on the side of the face and neck, in order to access and remove these glands. But for certain conditions, especially where patients get salivary duct stones or obstructions, there are much more modern techniques, what we call minimally invasive techniques, which can be done without any visible scars, utilizing tiny cameras that are called endoscopes to allow us to treat the problem much more effectively and safely for patients. So in the ones that I predominantly deal with are where the saliva gland has either got a growth, so what's called a tumor, and these can either be a benign tumor or a cancer, requiring them to be removed, or if the gland has got obstructed, typically by something called a salivary gland stone, which is stopping the saliva flowing out of the gland, and that causes the gland to swell and cause pain and problems to the patient. And then I have colleagues who specialize in the more minimally invasive surgery to remove stones and to treat any other causes of obstruction that I would refer my patients onto. So we have to break it down into two. So one is the parotid gland, which is the big gland that sits in front of the ear. I personally specialize in trying to do this with an invisible scar, and I can do that for many patients where we approach it from behind the ear rather than the more traditional approach, which is a scar in front of the ear onto the neck. But the main risk that patients have from this type of surgery is one is the scar, a risk of bleeding, a risk of infection. The nerve that moves our face runs through the gland, and so when we operate, we have to preserve that nerve. So that nerve does carry a small risk of injury, which can leave weakness to the face. There is a risk of fluid or saliva building up under the skin, which may need to be drained, and patients can also complain of numbness. There is a small risk of symptoms recurring, and that may require further surgery or treatment. The other major salivary gland, the submandibular gland, is approached via an incision on your neck. And again, the risks with that are the risk of scar. There is a risk of damaging some of the nerves nearby, which control the corner of our mouth, the taste sensation to our tongue, and moving our tongue. Again, the risks of bleeding, infection, and the chance that the tumor can come back and may require further surgery or treatment. So generally for this type of surgery, we would advise patients they would need an overnight stay in hospital, though we are trying to do more as a day case. And in general, we then advise patients to have 2 weeks at home off work to allow them to recover, for the wound to heal safely, and then they can return to their normal activities.